morning, everyone. This 30-minute somatic flow will just help you loosen up all of your fascia. We're going to focus around the hips, but we'll work from the feet all the way up to the neck. And it's just designed to be a great way to wake up or end your day, or really anytime you can fit it in. As you can see, I am here in my bedroom. I am practicing on my rug. You don't need any fancy equipment. You just need to be able to lie down on the floor and slide and glide. So if you do have a yoga mat, you might want to place a blanket on top so that you're not stuck to the mat and you're able to slide and glide freely. So we're going to start on our backs. You want to be able to have room to stretch your arms out on either side of you. And this practice is all about sensing and feeling what is happening in your body in the moment. It's a powerful mindfulness practice and a good way to learn to start really listening to your body's signals. So as you arrive here, first just drop your bones into the surface beneath you. And notice what you feel. Right? Notice what you feel on your skin, the floor, the rug, the air, your clothes. Right? Notice the weight of your bones. And take your arms down by your sides. Turn your palms down. And what does it feel like under your palms? Lots of nerve endings in the hands, of course. And then go a little deeper under the skin. Where do you feel pulses right now? Feel little, even more subtle vibrations. A little firing of the nervous system. Can you sense, without controlling it, the flow of your breath? Now bring hands onto your belly and deepen your breath. And as you deepen your breath, can you sense under your hands the belly rises as you inhale? And it naturally falls as you exhale. And really what's happening here is we are breathing with the full lungs by mobilizing the diaphragm. Diaphragm is that horizontal muscle and sheath of connective tissue under the lungs, under the rib cage. It's not just in the front of the body, it's 360 degrees. So as you continue to expand on the inhale, can you feel that in the back, low ribs as well? And then slide your hands to your hip bones at the front of your pelvis or your hip flexors, rest them there. The first move is a hip up slip and down slip. As you inhale, flex one foot, press through your heel, sliding that leg away from your shoulder, and exhale, relax. Inhale, other leg. Press through the heel, slide and glide the leg away from your shoulder, your head, and exhale. And as you slide, just observe what you feel and where you feel it. In your foot, your leg, your pelvis, and maybe even up into your low back. Maybe even further up the spine. So constantly checking in, that sensing and feeling. It's like an ongoing meditation on what do I feel and where do I feel it right now. And can you ask this question with almost a childlike curiosity? No matter how well you know your body or how much movement you've done in your life, there's always deeper to go. All right, let's take a little pause. Drop your arms, drop your legs, and take a deep inhale. And exhale with a sigh. We rest often in this practice to observe again. What do you sense? What do you feel? Now, how are those little vibrations and pulses? Okay, hands back to your hips or hip flexors. Relax your legs, so legs are heavy. And with as little muscle engagement as possible. You might even imagine you're a puppet and the puppeteer has strings tied to your bones. Just slowly bend one knee out to the side, sliding that foot up towards your groin. And exhale, slowly slide it back down. The same leg again, and go slowly, inhaling, slide the foot up. And exhale, slide down. And maybe one more time. Brief pause at the bottom. Sense right leg, left leg. Then just change sides. A few rounds on side 2. Can you continue with the belly breathing? What do you notice? Maybe any difference between your two sides? And after a few on each side, alternate a few rounds. One side and then the other. As you observe any difference between your two sides, remember the words of Moshe Feldenkrais, one of our somatic movement masters, teachers. We observe not to fix, but to learn. a lot of big, heavy, heavy helping of acceptance in this practice. What is this like for you right now? Letting go of the rule book, the measuring stick. Okay, let's take a pause now. Drop arms, drop legs. And observe now the pulses, vibrations. Maybe strong sensation in the legs or elsewhere. No right or wrong place to feel it. Okay, hands back onto your hip bones or hip flexors. Just a little internal rotation for the legs. So as you inhale, you'll turn your toes inward toward the midline, but really the rotation's at the hip. So the whole leg turning in, and exhale, drop it back out. Inhale, other leg. I guess we could have repeated a few first on one side. We did with our Baddha Konasana last move. But it's okay, you could do, one side or both. And just observe, what is that rotation like for you inside of the hip? Now, if you run into pain, and I say that because I just did a little bit. If you run into pain, pain is just a signal. And if you do, it's a signal not to be ignored. You want to notice it. Back out a little and just slow down and get curious about maybe where exactly in the movement does that pain pattern begin? Can I back out a little bit? Can I sort of gently tap around it? So we're learning in this practice not to fear pain patterns, but to listen to them, be curious, and definitely to honor the body's signals. Okay, and then pause, lots of pauses in the practice just to notice in the space between the movement, what is here? What's here for you? Now, we're going to do both at the same time, so toes turn inward toward each other. Toes turn outward away from the midline. You can start slow with breath like we did each individual. And then go faster. So one of the few times, sometimes we shake. Sometimes we move fast in this practice. So go ahead and shake your legs out. Can you soften? So again, like puppet legs. Like you're trying to shake the muscle right off of the bone and shake your feet right off of your ankles. Just observe what is arising, what changes are happening in your legs or anywhere else. Notice the psychic level too. So this work, mind and body are one entity, not separate. As this changes in your body, what's changing in the mind? You always take audible exhales to release. And slow it back down to articulate fully a couple of times, in and out. in and out, and then drop everything all the way back down. Let's take a deep breath. Exhale with your vocal cords. So shaking is for the nervous system, like what a duck, you might watch a duck or a goose, swimming in the water, who gets into a little altercation with his friend. They might squawk at one another, rah, rah, and then they just pull away and shake it off. Your dog gets really wet and stressed out, maybe doesn't really want to get wet, or he does want to get wet, and then shakes it off. And how does that feel in your body? Okay, bend both knees, plant both feet, and slide your arms out to a T. If it doesn't bother your shoulders, bend your elbows. So hands are on the floor and your arms are like goalposts. Take a deep breath into your belly. As you exhale, round your low back down into the floor. Inhale, arch your back. And exhale, ground. And off you go, nice and slow. Spinal undulation 1. Moving up now into the lumbar spine. What is this like for you? Is one part of the movement less restrictive than the other? Or feel better? Does it feel like a relief or some kind of a release? Does one side of your pelvis feel different? One side of your back? And trust your intuition on these questions. And often we don't know in a logical way. The body can, some words will just pop into your mind. Which side of you is tighter? Okay, and then just a brief pause here. Now sense and feel the weight of your sacrum. And take your arms all the way out to T. Straighten one leg down the mat. And as you inhale, push the bent knee foot into the floor. In-swing your bent knee over the midline and gaze opposite. Exhale, rock back to center. Spinal unwinding. So now you're turning the pelvis one way, turning the gaze the other. And so we move on up the chain. What is this one like? For me, this is a wonderful place to explore the diaphragmatic breathing. Letting belly rise as you inhale, like an ocean current rising, and fall as you exhale. And what is this like on the bent knee side of your low back? You let the bent knee side shoulder blade be heavy. Okay, and then just change sides. You can pause or not pause. Just move to the other bent knee, pressing into that foot, and swing the knee as you look opposite. It's really great for unraveling the fascia of the lower lumbar and upper sacral vertebrae. What do you feel around that bent knee side of your low back? And sometimes if there's a spot for me that feels tight or painful, I will direct my breath to that spot on the inhale. And imagine the exhale could remove tension from my body. Mind, very powerful tool in our healing journey. Okay, go ahead and pause. Drop legs, drop arms, drop your bones. Let's take a horse breath. Soft lips. You inhale. And blow your exhale out your lips like a horse. And what was that like for you? Can you just sense the aliveness, the receptivity of the body, your cells? All right, so stay heavy, just roll onto one side and use your bottom arm as a pillow. Unless that hurts your shoulder, you could grab a pillow or anything to prop your head up. Knees are bent in a kind of a fetal position here. This is called the Sidelying jackknife. And as you inhale, top arm and leg extend away from each other in space. Exhale, draw elbow and knee in toward each other. Again, inhale, expand, extend, lengthen. And exhale, draw it all the way in. You might begin to sense how there's a spinal undulation happening here. As you stretch out, a little bit of an arch through the back, through the low back. And as you squeeze in, there's that curl, that tuck. Probably on the exhale. So one of the principles of this practice, my teacher calls it spontaneity. T.S. Little is my teacher, the founder of this practice. Spontaneity just meaning start to trust the body more as we feel into the principles. And just what does your body want to do? Does it want to pause? Or sometimes I'll want to take my top leg back in space a little bit and pulse or roll the wrist or ankle. So within the realm of what we're doing and moving slowly, fluid like water, what does the body call for? So getting back into body as a natural home. Not a machine, but a place to live. A place to celebrate living. It can be kind of hard to celebrate when our bodies are tired and achy and arthritic and in pain, but there is a way out. There is a solution. And you're doing it right now. Okay, pause, roll onto your back, drop your bones, And just sense and feel what's here for you now in the space between. And then other side. You stay heavy, head stays relaxed. Arm is your pillow unless you need extra support. And off you go. Inhale, extending top arm and leg away from each other in space. Exhale, elbow to knee. And observe what's here on this side. Is it different? Move as if you're swimming through the salt water, the ocean. A very, very salty ocean. So it's dense. Even viscous. Feel the air has a little resistance as you move. So movements become for me sometimes almost dreamlike. Okay, and this time pause on your belly. So just roll to your belly, stack your hands, and rest your forehead on your hands. And my sound's gonna get a little weird here, and I apologize. We're gonna get more high tech. It's my first one. So hopefully you can hear me. I'll speak a little louder. All right, rest your head on your hands and expand your breath down into your belly. A great place to really sense the belly moving with breath because you have the floor as sensory feedback. You might notice that breath cascades up into your back, maybe even into your hips, and you feel movement in the hip joint, the pelvic floor. As you inhale, simply lift one straight leg up away from the floor. Exhale, release. Inhale, other leg. As you release, let go. So you might notice each breath really has 4 parts to it. And that includes not just the inhale and the exhale, but there's a little pause at the end of each. So on the inhale, you lift, and then you kind of briefly pause. It might even be a millisecond. And on the exhale, you release, you disengage, and then you rest. So we're engaging the tissue, releasing the tissue, and then resting. Like you would squeeze and release a sponge to saturate that sponge. And really this practice is just about saturating the tissues and then soaking in that stillness. And is one side different here? Very good move to strengthen our SI joint, so the area around the SI joint. Okay, take a brief pause. Curl all 10 toes under, press your heels back, ground your pelvis, lift your head, walk your elbows in under your shoulders and take opposite hand to elbow. Keep pressing heels back, ground your pelvis and drag the skin of your low belly forward and up. Just hold in this spinal extension. And then release your hands, elbows wide, rest your head, relax all the way down, releasing your feet. Let's take a Brummery breath here. So Brummery is a low-pitched audible hum as you exhale. You breathe in and then exhale with that hum. And what is that like? What is the felt sense of that sound in your body? What's the felt sense? Maybe a couple more rounds. Okay, let's dive back over onto our backs. It's about time to rest, but first, bend your knees and plant your feet. Interlace your fingers behind your head. As you inhale, ground the elbows, arch back, chin away from chest. Exhale, round your low back, squeeze forearms to temples, lift your head, neck, and chest. Inhale, arch your back, elbows wide, chin away. Exhale, round your low back, squeeze your elbows all the way in. Lift head, neck, and chest. So we're pumping the arms like butterfly wings. So inhale, arch, open, chin away. Exhale, round the ground, squeeze and curl up. Last round here. And as you exhale, come all the way up and pause at the top and take ever so tiny little baby pulses, just little, and then drop it all the way down. For your final rest, Shavasana. As you come to your Shavasana, you bring awareness to your midline from the crown of your head down to the arches of your feet. And whatever your perception of your midline is here, can you broaden your perception of the midline? Like a great valley between the mountains. Can you feel that midline broaden, and what is the felt sense in your body? And in that great valley, for the next few moments, we just rest. In the richness of our own vitality. Take a deeper breath and bring some movement back to your body. Enjoying little movements, little stretches, whatever comes naturally to you. Eventually roll onto your side and pause. Curl up here and offer your body so much kindness and love. There's a wonderful book, and it's called The Body is the Subconscious Mind, based on the neuroscience of how connected our mind and bodies are, and even connected. They are literally two parts of the same. So can we make friends? We make friends and beloveds with our body. And gently rise and find a comfortable seat. Just bring two palms together, rest thumbs to sternum, and close your eyes or find a soft gaze. You set the intention just for today, no matter how busy you are, whatever's left in this day. Can you approach it with curiosity? And maybe that deep belly breath, just a little more slowness. What would that be like? A little pause. You approach your day with a pause. And always, may you be happy, may you be free, may you live a life of inner ease. Namaste.